How's it going, everybody? This is Glenn Akins with Summit Sports Medicine Marketing and co-creator of the Doctor Marketing Blueprint. So today's topic is a big one. It is really maybe one of the biggest topics or things that you need to be paying attention to that's going on online for your practice. So today's topic is going to be on, is your staff costing you patients? Kind of scary, isn't it, when you think about that? You know what's going on with your interactions with the patients, and trust me, the patient's attitude, I have experience working in a clinic, and from the time that I brought patients back to the rooms for the surgeons that I was working with, to the time that that doctor went in the room, it was like a completely different person. So you, as your physician, may not know or understand or comprehend the full breadth of what your patients, their attitudes, and how they're being treated up at the front desk, the phone line, when they call to make an appointment. So here's a good example of what I'm talking about. So your online reviews, 9 out of 10 patients, before they make a decision on who to call, who to be seen by, what doctor they want to pick, 9 out of 10 of them are going to call a practice that has at least a 4-star rating or higher. So if you get online and you see from maybe the big three would be Google, Yelp, Facebook, if you have a 3-star or lower rating in any of those or on any of those platforms, then you need to get that changed. But my example today is I had a physician call me, and a client of mine, and he was freaking out. He was upset because on Yelp he has a 1-star review. And he was really concerned because when he saw the patient, everything was fine. Patient was happy, everything seemed great. The patient was getting better, doing well, healing. But that same patient on the outside of the clinic had given him a 1-star review. And so I was like, well, what happened? Tell me more about this. And he went on to explain that the review was talking about his phone staff and how his phone staff was short with her on the phone. They sounded rude, sounded rushed, sounded like they were in a hurry to get off of the phone. And this triggered that patient to give him a 1-star review. So long story short is you need to be sure that you're educating your staff from the phone room to the front desks to the checkout, to your nurses, to your techs or assistants. They all need to be making sure that they're treating patients really well and that they're treating that patient like they're the best thing on earth, and that just like you would treat somebody, so like you would want to be treated. So that's really the lesson in this. And so Lori and I, we want to do the best that we can to bring you value. And so we need your help on this. If you want to learn more about this topic, will you do us a favor? Down below in the comments section, will you write yes please or like our post? Because what we want to know is if you would like us to create a guide for you on how to get better online reviews. And if we get enough yeses, we get enough likes, then we're going to create that guide, and we will post a link to that in here for you guys. But we are trying to bring you value and trying to help you to grow your practice online the best that you can. So remember, guys, treat patients, have your staff, make sure your staff is treating patients the best that they can, the best that you know how, and make that patient's experience like a Disney vacation experience. Everything's happy, everything's good, and that will lead to better 4 or higher star online reviews. So remember, guys, if you want to learn more about growing your practice online and you need more tips or are looking for more tips, go to our website, drmarketingblueprint.com. You'll find some freebie giveaways there that we just want to give to you to bring value. And we will talk to you later. Take care, everybody. Have a great day.